So hello, everyone, and welcome to the 2022 Equine Industry Symposium, Horses in Human Health and Learning. For those of you joining for the first time tonight, my name is Amanda McFarland, and I'm an event marketing and communications professional and a proud Bachelor of BioResource Management graduate. This year, I've had the pleasure of teaching event management in the University of Guelph's Bachelor of BioResource Management Equine Management program and serving as part of the Equine Industry Symposium committee. The symposium is hosted by students in the BVRM program, and they've been working hard all semester to help organize this event. Last night, we started to see their efforts come to light in the first night of the symposium, and I'm sure that tonight and tomorrow will be just as great. I'll be turning it over to them in just a minute. The purpose of the Equine Industry Symposium is to address long-term and big picture trends and issues in our industry. Whatever your role, everyone involved with horses faces themes that are common to all of us and require our collective attention, such as the welfare and well-being of the horse, the long-term health and growth of our industry, and developing standards to keep abreast of legislation, societal expectation, best evidence-based practices, and the fiscal realities in order to get and stay ahead, rather than to be constantly reactive and following. And the role of a university is to seek truth and understanding and to assist in education and the dissemination of knowledge. Its role includes encouraging and participating in open discussion where diverse views and perspectives can be presented and critically examined, always with a view to increasing understanding. The hope is that in this process, the university will help to improve life for everyone. Tonight, you'll be hearing from students, incredible speakers, and our featured speaker, Nina Ekholm Fry. Nina was with us last night and will be with us throughout the rest of the event, leading us through our journey of learning on this topic. Nina, thank you for your efforts in putting together this incredible speaker program and facilitating the event. Thank you to all of our partners and all of our speakers and everybody involved. This is truly a team effort that goes into organizing this event. And with that, I'll pass it over to BVRM student Braylon Collin Robb to get us started.
Hello, my name is Braylon Collins Robb, and welcome to the second night of the 2022 Equine Industry Symposium. For those of you joining us for the first time tonight, our theme this year is Horses in Human Health and Learning. Last night was our first night of the symposium, and our speakers, Nina and Dr. Murphys, gave insightful presentations on horse-to-human interaction research, as well as equine-assisted services. Tonight's topic is therapy, taking a look at different therapy services that include horses. We are going to hear from Dr. Katy Schroeder, a mental health professional, and Sarah Michelle Senechal, an occupational therapist. Tonight's session will also be recorded and shared on the BVRM YouTube channel. Before we begin, if you were here last night, you will have heard that we are giving away 2 prizes each day. I am pleased to announce yesterday's winners. The Schlees saddle fitting voucher will go to Jill Springate, and the gift card to a tack store provided by Golden Horseshoe PEMF Therapy will go to Tricia Boyd. Congratulations! We will reach out to you via email to connect you with your prize. Next, I'd like to share some information about the Bachelor of BioResource Management Equine Management degree program. It combines both hands-on and lecture-style learning and prepares graduates for careers that require leadership and management skills. It is geared towards developing equine industry professionals, and the program is the first of its kind. The program is a blend of both business and equine science, including courses in biology, anatomy, nutrition, and welfare, in addition to accounting and other business development courses. One of the things I enjoy most about the program is the unique equine-related courses that are one of a kind in Canada, the small class sizes, and how there are hands-on opportunities throughout the program, allowing what you learn in class to be applied in real life. Next, I would like to thank our partners. Ontario Equestrian and Equine Guelph are long-term partners of the symposium, helping to organize and promote the event. We want to say a special thank you to Hilary Gregory at Ontario Equestrian for her role in running the Zoom platform for the event. We'd also like to thank returning platform sponsor, KX 94.7, Canada's #1 country radio station, serving the communications of Hamilton, Burlington, Oakville, and the rest of the Golden Horseshoe from Niagara to the western boundaries of Toronto, and home to the Canadian Country Music Association's 2014 Personalities of the Year, Toph and Melissa. We also like to thank Schlees Saddlery Services and Golden Horseshoe PEMF Therapy, who have partnered with us this year as well. Thanks to their contribution, we are able to raffle off some fantastic prizes tonight. By attending each night, you are automatically entered for our daily raffles. Schlees has provided a free saddle fitting appointment to give away each night. These sessions are valued at $179 each. And Golden Horseshoe PEMF Therapy is sponsoring our second raffle prize for a tax shop gift card. The winners from tonight's session will be announced tomorrow, so be sure to tune in then. At this time, I would like to invite Hilary Gregory from Ontario Equestrian to bring greetings on behalf of OE.
Thank you, Braylon, and good evening, everyone. My name is Hilary Gregory. I'm deal with everything from riders to our high performance program, GRIT. On behalf of the board and staff of Ontario Equestrian, thank you for joining us this evening. You have an incredible lineup in store for you this evening, so I'll keep this short and sweet. But it is now my second year assisting with the Equine Industry Symposium, and I continue to be impressed with how it contributes to the equestrian community as a whole. And OE is thrilled to be able to support this event, and most importantly, students who are this off. And it's truly a pleasure to be in the likes of such brilliant minds as well. So I won't keep you any longer, and I'll pass it back to Braylon. Thank you very much.
Thank you, Hilary, and thank you for all of your help and expertise. In lieu of speaker gifts for this event, we will be making donations to organizations that work with horses in human health and learning. All right, thank you for participating. And thank you to all of our speakers for sharing their knowledge with us during this year's Equine Industry Symposium. Tonight, we will hear from Dr. Katy Schroeder and Sarah Michelle Senechal. There will be a combined Q&A period after their sessions, but please enter your questions into the Q&A box as you think of them. Now, I'm pleased to welcome back and introduce Nina Ekholm Fry, our featured speaker from the University of Denver.
Thank you so much, and welcome again to the second night of the Equine Industry Symposium. And as I expressed yesterday, I am so thrilled about the focus on human health, horses in human health and learning services. In yesterday's symposium session, we were oriented to this area of human-horse interactions, which sometimes can be a little confusing. And our overview and research overview from the first night helped orient us to the purpose of this symposium, which is to provide professional and science-based information about areas where horse interactions are incorporated in human health or therapy and learning services. We talked about things like terminology and how this symposium strives to use descriptive language. So instead of simply using a term that may or may not be accurate, for instance, we learned not to use the term horse therapy or equine therapy, and instead to be clear, what is the human service provided, such as physical therapy or such as psychotherapy or such as special education or social emotional learning on the learning side, and that horses are included or incorporated into that existing service. We also talked a bit about the horse themselves, who they are and what role they serve in these human health and learning sessions. And we heard from Dr. Katrina Merkes about the science of human-horse interactions and some of those misunderstandings that we may hold about the horse participating in ways that are more human-like, as opposed to who they are as their own unique species. We also discussed welfare and research in horses in human health and learning. Today, for our second symposium session, we will focus on therapy, and I'll briefly share an overview of the session areas here. And for tonight, we will be talking about therapy. And horses can be incorporated or included in therapy services in, you could say, two broad areas, but these are actually all different therapy services. Therapy services such as psychotherapy or counseling. These are done by typically master's and doctoral level credentialed mental health clinicians. And we'll also talk about how equine movement is incorporated in therapy services like physical therapy, occupational therapy, and speech language pathology. We are going to have a joint Q&A session at the end or after both our speakers for tonight have presented their in-depth material. And it's interesting, and you'll note that the way to talk about the incorporation or inclusion of horses in therapy services, credentialed healthcare services, is actually similar, even though these are different services. So horses are incorporated as a treatment technique, or the interaction is incorporated, or movement is incorporated as a treatment tool. In other words, horses are not therapy, and interacting with horses does not constitute a standalone therapy service. But we will hear much more about this from our very experienced speakers and practitioners tonight. In a moment, you'll be introduced to Sarah Michelle Senechal, who's an occupational therapy, and after we'll hear from Katy Schroeder, who's a clinical mental health counselor. And you'll see me again at the Q&A after both our speakers. As a reminder, there is a Q&A box at the bottom of your screen. That is the right place to submit your questions for the Q&A. And a small tip: as soon as you think of a question to ask, go ahead and put that in the Q&A box. It won't interrupt the presentations at all, and it might make it more likely that your question or theme of question is selected before we launch into the actual Q&A time. And that is it for me, and I will pass it along to Braley. Thank you.
Thank you, Nina. Next, I am pleased to introduce our first speaker of the night, Sarah Michelle Senechal. Sarah Michelle Senechal is a Manitoba licensed occupational therapist. She received her Master of Occupational Therapy from the University of Manitoba. She is an AHCB certified therapist with the American Hippotherapy Association through the American Hippotherapy Certification Board. Sarah continues to expand her knowledge and the knowledge of other therapists about equine movement and hippotherapy used as a treatment tool through student mentorship and her involvement with the American Hippotherapy Association Incorporation as the chair of the Canadian Council. Sarah and her colleague Karen have collaborated to pair bodywork with therapeutic techniques to promote healing from physical discomfort and emotional symptoms resulting from trauma or stress. Their work has been taught internationally and is being carried out by European therapists. Welcome, Sarah Michelle. We look forward to hearing from you.
Okay, so thank you, everyone. We're so glad that you're all here joining us tonight. So really the purpose of tonight's presentation is just to have a nice dialogue all together about the different ways that health professionals can incorporate equine movement and interactions into human health and learning. So the learning objectives for today are really a general understanding of what is hippotherapy, or the use of equine movement as a treatment tool, why you might consider skilled therapy interventions with equine movement, how does it work, why do we use it, identifying who it's beneficial for and who is qualified to provide the skilled therapy service, as well as briefly touching on some considerations when choosing to incorporate the horse into your treatment sessions. So let's start by describing what we're really talking about. We're talking about movement. When a horse's movement is transferred to a patient through the use of hippotherapy as a treatment tool, it produces a combination of sensory, motor, and neurological input that we use to treat a wide variety of diagnoses. Horses create a dynamic, three-dimensional movement that can't be replicated in any other clinical setting. The horse's pelvis shares the same three-dimensional movement as the human pelvis. And this movement, again, is multidimensional and provides a system-wide impact to our clients. Receiving the movement transmitted by the horse's pelvis helps our clients develop physical skills needed for everyday life. In short, what we're saying is that the dynamic movement of the horse combined with the dynamic environment of the treatment setting leads to functional change. The therapy does not teach in any way riding lessons. Rather, the goals are geared towards the independence with activities of daily living and increased participation in family, school, and community life. In response to the horse's movement, our clients make improvements in balance, strength, coordination, and postural control, just to name a few. In addition, the horse's rhythmic movement and patient's position on the horse can be changed. This provides specific and regulating input to hearing, visual, skin, and joint sensory receptors. Once regulated, patients are then able to interact with their environment and have improved attention and communication. Improvements in all of these areas can result in increased participation and independence with activities such as walking, dressing, and playing. By applying different combinations of patterns, speeds, and riding postures, our highly trained therapists are able to provide precisely the sensory and neurological input each client will benefit from most. We want to always be thinking about promoting function in generalized contexts or everyday life. Our clients' functional goals are what guide our therapy. As any of you with children or siblings will know, when a baby is learning a new skill, it takes a lot of repetition to establish that skill initially. What skillfully manipulated equine movement provides is the opportunity for sustained and graded neuromotor input that's multidimensional and multimodal at an average rate of 100 beats per minute, because the average rate that a horse walks is 100 steps per minute. And so what that translates to is it produces an average of 2,000 to 2,500 neuromotor inputs per therapy session for our clients. Therefore, equine movement really provides hundreds of practice opportunities in one session, requires continuous problem solving on our client's behalf, and provides variability of practice, all of which are essential components for the brain to map out a new skill. Other examples of dynamic movement tools that we can use throughout sessions in occupational, physical, or speech therapy include things such as trampolines, various therapy swings, and AirX pads, just to name a few. The leading professional organization that provides training to interested occupational therapists, physiotherapists, and speech and language pathologists is the American Hippotherapy Association. If you want to note the YouTube address here on the right-hand side, the AHA has created a great educational video for all of you to be able to access. In simpler terms, the use of equine movement as a treatment tool, also known as hippotherapy, is used by specially trained physical therapists, occupational therapists, and speech language pathologists in applying movement, rhythm, and repetition of the horse as a treatment strategy to help patients achieve their therapeutic goals. So let's discuss, why isn't this changing? Okay. So let's discuss a brief overview of all three professional designations that incorporate equine movement as a treatment strategy. What is physiotherapy? Physiotherapy is a skilled service provided by a licensed physical therapist to promote mobility and movement for people of all ages and all levels of function. Physiotherapy services typically include customized treatment programs to improve one's ability to be mobile, whether that's crawling, walking, running, or pursuing athletic activities. The goal is to achieve optimal independence in the patient's chosen environment in the most efficient and pain-free manner. The physiotherapist may use handling skills, targeted strengthening, balance skills, sensory adaptation, adaptive equipment, treatment tools, modalities, and modified environments, and/or patient caregiver education to decrease the activity or participation restrictions identified by the patient. Essentially, physiotherapy helps people by addressing functional mobility to do the things they want and need to do. What is occupational therapy? Occupational therapy is a skilled service provided by a licensed occupational therapist aimed at enabling people of all ages to live life to its fullest. A full life means engagement in the activities that that person wants and needs to do, no matter what injury, illness, condition, disability, lifestyle, or environment stands in the way. By analyzing and addressing the many different skills required, occupational therapists make everyday tasks like getting dressed, brushing teeth, writing, drawing, feeding ourselves, and playing appropriately with peers possible. What is speech and language pathology? Speech and language pathology is the service that a licensed speech and language pathologist provides to ensure that all people with speech, language, and/or hearing disorders can communicate effectively. The speech language pathologist is a medical professional who works to prevent, assess, diagnose, and treat speech language, social, cognitive, communication, and swallowing disorders for people of all ages. They may use a variety of tools or strategies, including addressing oral motor, respiratory, cognitive, postural, and social functions, augmentative means of communication, sensory adaptations, and/or electronic equipment or hearing devices. So that brings us to the how. How does this happen? Well, treatment plans and sessions are usually done by a licensed therapist in line with what we call their scope of practice, their practice standards and training. The therapist incorporates equine movement and the equine environment as a treatment tool within their profession. Therapy sessions are usually done individually. However, they could also be conducted in a group. The therapy team typically includes the therapist and one or more individuals that are either volunteer or paid positions to assist with the horse handling, and as well as a sidewalker. Okay, so to discuss a little bit how each professional incorporates the use of equine movement into their plan of care within their scope of practice, we'll discuss a few examples. So the occupational therapist, for example, is able to combine the effects of equine movement with other standard intervention strategies to work on things such as fine motor control, sensory integration, feeding skills, play skills, attention skills, emotional regulation, that's a big one, and functional daily living skills in a progressively challenging manner. The physiotherapist, on the other hand, overlays a variety of motor tasks on the horse's movement to address the motor needs of each patient to promote functional outcomes and skills related, such as gross motor ability, like sitting, standing, and walking. Whereas the speech therapist utilizes the movement of the horse to facilitate improved respiratory function, breath control, and oral motor function. These effects are combined with standard speech and language intervention techniques to target things such as articulation, fluency, and auditory processing. Using the natural environment, the therapist also can address things such as expressive language, receptive language, and social pragmatics. Who do we serve? Clients range anywhere from 18 months old to adults with mild to severe neurological, sensory, oral motor communication, and or motor deficits. Typical client limitations or impairments that we tend to see be the right fit to use equine movement as part of their treatment plan are things such as poor balance, poor gross and fine motor control, poor sensory processing, limited functional reach, so that's the distance at which you can reach without losing balance, poor sustained grasp, so that's being able to maintain your grasp on an object, and impairments in oral motor functions such as communication and eating. With the use of equine movement as a treatment tool, we can see changes in gait development, in balance abilities, in gross and fine motor development, in body awareness, writing reactions, and postural alignment and stability. We can also see improvements in motor planning. We can see improvements in attention and language development. Who can provide services incorporating the treatment tool? In order to be licensed as a physiotherapist, occupational therapist, or speech and language pathologist in Canada, you need a minimum of a master's degree. The American Hippotherapy Association then provides training for the use of equine movement for qualifying professionals in the fields of OT, PT, and speech. The American Hippotherapy Certification Board then, as a separate entity, provides 2 levels of board certification. There's the AHCB certified professional or the hippotherapy clinical specialist. If any of you joining us this evening are interested in joining the Canadian Council to be kept in the loop of upcoming educational opportunities and resources, please take note of the email info@stableconnections.ca and reach out to us so you can be put in touch with our support group. All right. Things to consider when we're going to include horses into our treatment plans. Walk is typically the gait used during treatment sessions. And so even though it's a slower gait and tends to be more controlled, we do have to think about variables. So not only does your horse need to have very good behavior when it comes to handling such as stop, go, turn, increase and decreasing speed, but the horses need to be skilled in what we call long lining. And why do we long line the horses during therapy sessions? The purpose behind the treatment strategy of hippotherapy is the horse's movement. So when we long line, we're allowing the horse more freedom of movement through his head and shoulders because he's not being blocked by a leader. And how do we achieve the best movement quality? Well, in order to provide the best movement quality to our patients, the horse needs to be able to use their back and their haunches correctly. So when used appropriately, the horse is able to bring his legs underneath him, which we refer to as tracking up, and walking with more intensity and impulsion. Once we get that achieved on the long line, it's a much more beneficial movement provided to our clients to work on their therapy goals. The advantages of long lining are really that when our therapists are asking for changes of direction, which we often will do because we need to balance left and right side, we don't need to come to a halt so that our leader can change sides for safety in the arena. So it allows us to continue with our session without interruption because the horse is being driven from behind. Additionally, long lining also affords the long liner the ability to quickly respond to a request from the therapist. It often happens throughout therapy sessions that the therapist is responding to either a movement or behavior by the client that needs to be addressed quickly in order to change or affect the targeted behavior or movement. Since a leader doesn't always have control of the bit, similarly to a long liner, the long liner is afforded to respond a lot quicker or get a quicker response from the horse. As you can imagine, there are multiple factors to keep in mind when selecting a horse for use in therapy. The horse obviously needs to be sound, because when we think about a horse that might short stride on one of its legs, then that's the input we're providing the client, longer on the right, shorter on the left. And so we need to really provide sound quality movement to our clients in a rhythmical fashion. The horse needs to be sound and well conditioned to provide that quality movement. This is a job for the horse. It's a very skilled position. The horse also needs to be able to tolerate having people close by. Not all horses enjoy being surrounded by people. Some horses can be claustrophobic, and so that's something to keep in mind. They also need to be able to accept variations in positions of the clients on their back. Because we're not teaching riding skills, our clients can be in multiple different positions, such as facing forward, facing the rump, side sitting, in quadruped, in plank position, even standing up. And not all horses enjoy having people in those different vulnerable positions. Additionally, there's a lot of arena equipment and materials used. And so when we think of clients and horses alike, we can all have sensory preferences and we can all experience sensory overload by different sights, sounds, smells, and different input. And so it's very important to know each of your horses and what their preferences are. We also have various mounting and dismounting practices. And again, making sure your horses are well trained in all of those before pursuing further. Additionally, when we talk about horse considerations, there are horse considerations for the therapist as well. So when we think, horses come in all different shapes and sizes, just like us. And so we do have to find the proper match between a horse and a patient. So just for example, something as simple as barrel size, right? If I have a little patient who's only 18 months old, you can imagine their hips won't be very wide. I might not want to put them on a draft cross who's got a very wide barrel. But for some other patients that require a wider base of support at first to challenge their balance and then progressing to a bigger challenge, maybe I am looking for that wide base of support. So these are all things to keep in consideration when choosing your horses. Another thing to consider too is your horse height. So for example, I'm 6 feet tall. I can handle some of my therapy horses that are in the 16-1 range and still be able to provide adequate support for some of our higher needs clients, while also keeping track of the biomechanics and my safety for my spine so that I can have a long and healthy career. But not all of my team members show up to work and are 6 feet tall. We also have awesome therapists that are 5'2". And so it's having a range in your herd to be able to accommodate your staff and your clients alike, so that everyone can have a long and healthy career. Okay. Using equine movement is just one component of the treatment process. Licensed therapists incorporate other evidence-based treatment strategies to address each of the client's individual functional outcomes in our sessions. Every client's plan of care is developed holistically using a client and family-centered approach to help each client achieve their goals and reach their highest potential. There's no such thing as a hippotherapist. I can't stress this enough. We all have to lead with our therapy. We either provide occupational therapy, speech therapy, or physiotherapy services. Hippotherapy is simply one of our tools in our toolbox, and it shouldn't be the only tool we use during a treatment session with a client. If it's okay, I'd like to take a few minutes to go over a case study just to illustrate a little bit how things happen. So for example, we had a 3-year-old diagnosed with what's called rhombencephalosynapsis, or for short, RES. The family was told by their neurologist not to expect their child to walk before the age of 5, if ever. RES is characterized by a deficiency or absence of vermis with both hemispheres in the brain being fused across the midline. Patients tend to present with hypotonia or low muscle tone, so really floppy bodies, and motor developmental delays. Other neurological features other than poor balance are things like ataxia, which is really clumsy voluntary movements, abnormal eye movements, and some can also present with attention deficit hyperactivity symptoms. So before I dive into the client, let's think back to typical skill acquisition and motor development. We all have to develop in the 3 planes. So front to back, side to side, and rotation. So think with babies, the first thing they do is they develop head control, right? Flexion, extension, that's our front to back plane. Then they put their arms out to catch themselves, that's side to side. And then we develop into those more complex motor patterns in the rotational planes. So when we think about that development, rotation is key. That twist is important. The little twist of a baby's body means we're moving away from simple reflexive infant movement patterns, and we're starting to experiment with bigger and more complex movements. It means we're getting stronger and more confident to navigate a dynamic environment. That little twist challenges posture and body awareness. It allows us to begin to learn to shift our weight from one side of the body to the other. It also helps us tune our inner ear system, also known as the vestibular system, for balance to develop. And we repeat these things over and over again, just as little baby does. The little twist frees up the spine and switches on those abdominal muscles in a way that it physically prepares the baby to be stronger and more dynamic in sitting and standing for childhood and beyond. It fires up all the muscles from the teeny tiny toes all the way up to the glutes around the hips, and it's one of the most important precursors to learn how to walk. Trunk rotation is incredibly important. It's a foundation for so many other everyday movement activities around the home, the classroom, and beyond. I can safely say that trunk rotation or twisting, if it's compromised or it's a missing element in the majority of the children we see with movement difficulties. And it holds true for a range of movement disorders, anything from coordination disorders, cerebral palsy, etc. And so this is what we saw with this little client. The wonderful news about trunk rotation is it can be practiced and trained and learned. Typically, it's practiced in sitting, on the knees, or in standing, and doing things such as encouraging the child to reach around to an object. So in knowing that we develop front to back, side to side, and rotation, we carefully chose various position and postures to first challenge our client in that front to back plane, and then move to the lateral plane, and then rotational stability. So when we think of that front to back, these are things like in the clinic working on sit-ups. And then on the horse, this translate to starting and stopping to activate those abs and those abs for flexion and the spinal extensors for extension to help strengthen that front to back plane. The horse's movement encouraged our client with even weight bearing and trunk symmetry and facilitated the balance reactions. From there, we were able to get the client walking a month before turning age 4. The beauty of hippotherapy as a treatment tool is that clients really don't realize how hard they're working their mind and their body. I just lost my point. Okay. They're too busy having fun. And yeah, just keeping track of time. So I hope this general overview was informative for all of you. I want to thank you all, and I'll turn it back to you, Braylon.
Thank you, Sarah Michelle. This is a very interesting topic. It is amazing how horses play a role in therapy. Next, we will hear from Dr. Katy Schroeder, Assistant Professor of Clinical Mental Health Counseling. Dr. Katy Schroeder is an Assistant Professor of Clinical Mental Health Counseling in the Department of Counselor Education at the University of Iowa. Her scholarly interests broadly explore multi-species interactions with a special focus on the inclusion of horses in counseling and psychotherapy practice. Her areas of clinical and research expertise are in group counseling, qualitative research methods, and the human-to-horse relational bond. She's a national certified counselor. Katy has been involved in the horse industry for over 20 years through her background in competitive 3-day eventing and her work as a clinical mental health counselor, incorporating equine interactions in human mental health care services. Dr. Schroeder, thank you for joining us tonight. We are looking forward to hearing from you.
Thank you for the introduction, Braylon. I'm very excited to be here this evening and grateful to be a part of this symposium. Okay, everyone, I'm going to be talking today about the inclusion of horses in psychotherapy and mental health counseling, giving you a broad overview and a big picture of what this might look like in practice. So as Braylon mentioned, I'm currently an assistant professor at the University of Iowa in the Department of Counselor Education. And my background has primarily been in providing clinical services through group work, and that is my passion, group work with the inclusion of horses. I'm also a certified equine specialist in mental health and learning and therapeutic riding instructor with Path International. So I'm going to be covering the what, who, how, and why of doing psychotherapy with the inclusion of horses. I'll touch upon horse considerations, and I'll also share a case vignette with you of how this might look like in an actual session. So I'd like to start by talking about basic terminology around psychotherapy and counseling. So when we're talking about psychotherapy, broadly speaking, it's using verbal communication between a therapist and a client, and these interpersonal interactions as well, to assess, diagnose, and treat problematic patterns or issues that have come up with a person's thinking, their feelings and emotions, or their actions that are currently impairing their life in some way, or impairing their relationship with others. Psychotherapy broadly speaking, typically treats helping people cope more effectively with daily life, again, through identifying some patterns that might be impacting them in a negative way and their relationships with others. Psychotherapy is also utilized to treat diagnosable mental health disorders, such as major depressive disorder, anxiety disorders, post-traumatic stress. It is also utilized to treat and help with symptom management of more chronic or persistent mental illnesses. When we talk about mental health counseling, we're talking about a broad term for services that address not only mental health, but overall wellness, education, and career goals. These services are often given preventatively to help people navigate many common issues that are experienced across the lifespan. Counseling treatment targets typically involve improving interpersonal effectiveness across relationships, whether that's with friends, intimate partners, family, through work or school. Counseling can also be an effective approach for increasing vocational awareness and identification of career paths, as well as career development. Counseling is also utilized for life transitions and other types of stressors, such as various experiences of grief and loss that may be temporary or even long-term, divorce, job loss, and other areas that impact daily life. It's also utilized to treat mild to moderate symptoms that are associated with some of the mental health disorders I mentioned earlier, such as anxiety, depression, traumatic stress, even substance use. So when we're talking about the inclusion of horses in psychotherapy and mental health counseling, we are conceptualizing the idea that aspects of horses interacting with their own environments or interacting with people are then blended with and included in clinical treatment. And importantly, it is not considered a standalone treatment approach. Rather, the inclusion of horses in psychotherapy and mental health treatment is a technique utilized by counselors and psychotherapists. So why do we include horses in psychotherapy and mental health counseling? One reason is that horses provide a really interesting, novel social interaction for many humans, some who have never had an opportunity to be around horses before. They are very responsive to our body language, to our facial expressions, to our movement, to our vocalizations or tone of voice. And that feedback is important for helping us learn about ourselves. So in relationship with horses and with their reactions to us, we can learn more about ourselves as well. And the experiential component is a very important piece of the treatment. It allows therapists to work with clients in what we therapists term the here and now or the present moment. So instead of, for instance, talking about a relationship problem that a client has experienced when we're sitting face to face in an office, when we're out with the horses, we can work through and talk through the relationship issues through the client's work with the horse as well. So we can see a relationship happening in the present. This can be a very powerful way to talk about what's going on for the client and help them work through their issues. When we include horses in treatment, therapist observation of the client and horse interaction can be very helpful for an assessment. So for instance, when I'm observing a person meet and interact with a horse for the first time, I learn a lot about who that person is in the moment. And that can be very helpful. For me personally, not having to do rapid fire questions and asking a lot of information, doing a lot of history gathering in the moment really helps. So it's it's just a different approach of gathering history with your clients. Horses can also assist us with building rapport with our clients. So they may ease that initial anxiety that comes from starting counseling. So it's very intimidating, can be very anxiety producing to talk to a stranger about your problems. And so having the horse nearby and having the focus sometimes be on the horse first can help facilitate discussion, maybe promote some relaxation, and help build trust with the counselor so that we can really support a therapeutic working alliance. We can also address life skill development through including horses in treatment. So when I say life skill development, I mean that a client could try out a new behavior with the horse first before they go out into their daily life and try out acting or behaving in different ways, for instance, in a social interaction with other people. We can try these things out and experiment experientially with the horses. Including horses may also help improve motivation and engagement in therapy. So again, imagine yourself out on a ranch or a farm, you're in nature, you're with a horse, and Can be very novel and fun learning opportunity. And so it can change motivation and engagement just by the nature of the setting. And it's a multi-sensory experience. The equine environment can be experienced through all of our senses. This supports our awareness of our body, our somatic awareness of how we're feeling physiologically. And this can also enhance the work we're doing specifically to help people recognize how their body feels and how this relates to, for instance, emotion regulation. So noticing when my heart is racing when I'm out with a horse, and noticing how I can regulate that while I'm with the horse can be one way to experience that with the horses in this multi-sensory way. So now I'd like to touch upon who provides these types of services. And so I'm going to focus, since I'll focus mostly on the United States when I speak about practitioners, but I will say that it will vary depending on which country you're referring to in terms of who can provide these services. So in the United States, in order to practice independently as a mental health practitioner, you need at minimum a master's degree and state board approved licensure, whether that's a intern license, so a temporary license before you've accumulated all your direct hours with clients, or a full license. And in some cases, the specific profession requires a doctoral degree with state licensure. And some examples here are licensed professional counselors, which is a master's degree level counseling professional, counseling psychologists at the PhD level, clinical social workers, marriage and family therapists, and there are many more. This is just a snapshot of the practitioners. And there are specific competency areas as well that I'd like to highlight. So on the human side, mental health practitioners should have mastery of human psychology, behavior, communication, and have basic and advanced assessment skills, treatment planning, counseling and clinical documentation skills, just to name a few of the major skill groups. And on the horse side, equally important if you plan to include horses in treatment, is to have understanding, hopefully advanced understanding of horse care, training, and management, and equine psychology, physiology, and communication. And so understanding how horses feel, think, learn, and understand is equally important in order to effectively engage them in an interaction with a human as a treatment technique. So when we take these things holistically in the treatment approaches, mental health practitioners need to have intentionality when they incorporate horses into the session. So knowing what is the purpose, how will I accomplish this purpose, what can I expect, and what will we do during the session if I'm going to involve a horse. And that this mental health practitioner also can use equally ethical decision-making models for both the client's care and the horse's welfare. So client and horse welfare are important here. And how are services delivered? I'll give you the basic nuts and bolts. So we can offer equine inclusive psychotherapy or counseling individually. We can offer in groups, as is my favorite thing to do in my background. It can be with couples, or the service can be with families. No matter what the service is, whether it's individuals, groups, or focused on couples or families, the mental health care practitioner holds legal responsibility for delivering this intervention and overseeing it as a session unfolds. This is all under their liability and their licensure. And depending on the number of clients or the type of session that is occurring, a clinician might include assistants as well. And so often we refer to these folks who are assisting, volunteering, or paid work as equine specialists. And so, for example, in a group therapy session, if I have 4 to 6 clients in this group, I often will include specially trained assistants to help with the session and to ensure that clients have one-on-one help if they need it when they're working with the horses, and to ensure that we're going to have a safe and smooth session. In terms of who can receive these services, when we're talking more broadly about counseling and psychotherapy, people of all ages can benefit from these types of services. So anyone across the lifespan can benefit. And treatment addresses a broad range of mental health concerns, and not only concerns, but also life experiences that may even be more transient in nature. When we include horses in treatment, we also have to do additional assessments or taking more history with our clients during the intake process to ensure that the interactions with horses are going to be appropriate for that particular person or group of people. So, for example, it may be contraindicated to have somebody do sessions with horses included if they, for instance, have unmanageable or unregulated, unmedicated allergic reactions to the equine environment. So, for instance, if they are likely to have respiratory distress because of something in the environment, whether that's dust or horsehair or something else, we have to feel very sure that we can still provide a safe experience if their allergies can be managed in that setting. So that's really important to have a full history in that regard to make sure that you can provide a safe experience. Also to consider too that some people may have significant, really strong fears or phobias of horses, and it may not be appropriate for them at that time, or maybe later it will. But if somebody is very fearful around horses, you need to be very clear on whether or not it would be appropriate to include horses in their treatment plan. In terms of horse considerations, I want to talk about, just briefly, we can think of horses in an active or engaged role or a passive role. When they're in an active or engaged role, you can think of that as the horse interacting usually directly with the human. So they might be led by the client. They might be engaging in a grooming session where they're being brushed by the client, or they may be standing with the client. Maybe the client has their hand on the horse's shoulder while they're talking with their counselor. In a passive role, the horse might be observed. So there may be no interaction going on. So if you can visualize perhaps, for example, a therapist and a client standing at a fence line watching horses eat out in a pasture, or watching other horses interact with each other in an arena, maybe even sleeping. But sometimes there's therapy going on even when the client is not having an interaction with the horse. And importantly, for horses that are going to be included in mental health or counseling services, they must be able to have a tolerance for physical touch and human interaction. At bare minimum, they need to be okay with these things, because those things are going to happen a lot. And they need to also be able to tolerate various types of equipment and other materials that might be in their environment. They have to be acclimated to these things as well. So you heard in the previous presentation and saw through the visual aids all the different pieces of equipment that a horse might have in a physical therapy session. And while that might not be the same for counseling or psychotherapy sessions, the therapist may still have, for instance, props in the arena and other materials and equipment that the horse needs to be familiar with and okay with before they're included. For instance, having ground poles that the horse is led over with, the client leads the horse over the ground poles. And mental maturity is important too. Horses that are younger than 5 years of age might not be mentally mature enough. And every horse is an individual, so there's always exceptions, but we want to think about how mentally mature the horse is. Are they ready to do this work? Have they been socialized? What's their history? Do they have any previous problems with interactions with people that we need to think and consider so that we don't put in substantial or increase the risk for clients for working around these horses. Okay, so I'm going to be wrapping up this presentation with a case vignette to kind of paint the picture of what a session might look like. And I'm pulling this from a recent publication from myself and my collaborator that was published in the Journal of Mental Health Counseling. So I'm taking a tiny piece of a larger vignette from that article. So I want to talk to you about a hypothetical client named Sonia, who's interested in trying equine inclusive counseling. So her case history, she's a freshman at a large university. She's 5 hours away from her hometown, and she is currently really struggling to make new friends. Her self-confidence as a result is pretty low. She's feeling isolated and definitely sad down. And she's even close to considering dropping out next semester. She's not sure she even wants to come back to college right now. She is currently working with a counselor who incorporates horses into treatment. And this counselor offers Sonia an opportunity to do some focus sessions with a horse named Jackie. So in relationship to her equine inclusive sessions, Sonia's treatment plan might look a little bit like this. This is an abbreviated, shorter version. So her long-term goal is to increase her well-being, strengthening her interpersonal relationships. Her short-term treatment goal is to increase her self-confidence for making new friends at college. And with these goals in mind, the session objectives that the therapist has lined out is to help Sonia explore her character strengths, to identify some barriers and solutions that might be impeding her ability to make new friends at college. And with these objectives, the therapeutic interventions the counselor is going to include, she's going to do a specific assessment with Sonia. This is for those of you familiar with positive psychology, this is related to the theory of positive psychology assessment called values and action inventory. And she's also going to include a meet and greet activity with a horse. And so this session agenda would unfold this way. The counselor would first do the inventory with the client and discuss those results. Then move into the equine activity. Debrief this activity with the client. And then talk with the client about a plan for a next session. Okay, so we're in the session. Sonia has taken the inventory first, and she's discussing the results with her counselor. And what we learned from this inventory are some specific character strengths that Sonia possesses. She has an appreciation of beauty, a zest for life. Curiosity is a character strength for Sonia. Integrity is a value and strength of Sonia's. And social intelligence stands out from this assessment. So just keep these in mind in the back of your head as we continue to go through the session. So now we're moving into the equine activity. For this session, the counselor is arranging for Sonia to interact with Jackie in an outdoor arena like the one in this picture here. During this activity, Jackie will be untethered. She won't be tied anywhere. She'll be free to move around the pen wherever she would like, or the arena, wherever she would like. The counselor starts by giving Sonia some basic safety guidelines for approaching and working around horses. So this would be information about blind spots, for instance, where the horse can and cannot see her when she approaches. And then the counselor sets the activity up for Sonia. This is semi-structured. So leaning towards less structure than more structured. She simply asks Sonia, I'd like you to go introduce yourself to Jackie, Sonia. So go out there and say hello in a way that you would like to. So now the activity is unfolding. The counselor is close to Sonia and Jackie so that she can watch and be there if needed. And here's what she observes when she's watching Sonia and Jackie. The first thing that happens is that because this is Sonia's first time with a horse ever, she's never been around horses before, she's expressing some hesitancy about how she's going to approach Jackie. She's not sure how this is going to go or what she should do. While she's expressing hesitancy, Jackie has now moved to a fence post and she's aiming to itch a scratchy spot on her neck just under her mane. Sonia's eyes really light up. She's really interested in what's going on here, and she starts to walk closer to Jackie to see what she's doing. Now Sonia's very close to Jackie, but she doesn't make contact with her. She stands there very quietly, and Jackie then extends her muzzle forward to sniff Sonia, and Sonia allows her to sniff her outstretched hand. So that point of contact has now happened. And as Sonia's standing with Jackie, she decides to move a little bit to the side near Jackie's neck, and she wants to find that spot that Jackie was itching earlier. So she starts to scratch right there and get that spot for Jackie. And this is all what the counselor is observing and watching. Jackie reacts positively to this. If you've ever seen a horse react positively to itching, their lips wiggle, they might even stretch their neck out. And Sonia's smiling a lot as she stands next to Jackie and sees this. So now that's it. That is the interaction with the horse for today. And so the counselor and Sonia now move off to the side to talk a little bit about what happened with Jackie. The counselor shares her observations with Sonia, and then also, of course, inviting Sonia to talk about what she experienced with Jackie. And as they're discussing what happened through this conversation, Sonia becomes aware of how her character strengths showed up. So remember that bullet point list I gave you earlier. Now she's thinking about this interaction with Jackie and her character strengths. They identify the following strengths specifically during that interaction: that Sonia's curiosity really helped her shift from a place of hesitancy and worry to saying hello, to actually being more interested in what Jackie was doing and less focused on herself and her worry about how to say hi to Jackie. So that curiosity really stood out. And Sonia's social intelligence really came out when she patiently waited for Jackie to initiate contact and when she helped Jackie find that itchy spot. So then after talking about this, the session concludes with the counselor asking Sonia to reflect on the ways that she has used these same strengths in her relationships with people, with humans. And they talk more about, okay, so what are the possible barriers that might be impacting her or preventing her from using these strengths right now to make friends in college? So they're now transitioning into talking about, okay, what's going on? Here are your strengths. We've identified these things through your time with Jackie today. Now we're gonna keep moving and discuss what might be getting in the way at school. And she'll continue with Jackie again in several follow-up sessions to keep working on this particular therapy goal. So I hope that was a helpful illustrative example of what counseling might actually look like when you bring a horse and a human together. So thank you very much. I really appreciated the opportunity to share this with you today.
Thank you so much to our speakers for today. We are now ready to go into our question and answer session, and we have gotten dozens and dozens of questions that I will distill here to the best of my ability in the time that we have left. Something I noticed about the questions and also our chat activity is that the idea of concepts and terminology is an ongoing challenge, as we discussed in our first night of the symposium, meaning that today's focus is on healthcare services where therapists who are credentialed healthcare providers incorporate horses in their work. We will hear more about adaptive riding. Another term used is therapeutic riding. Those two terms mean the exact same thing. Adaptive or therapeutic riding is a recreational horsemanship and riding instruction. And we will hear more about that on the third day of the symposium tomorrow. But to start off our question and answer, we did have some questions about both terms as well as roles in therapy sessions. The first question will be directed to Sarah Michelle, and the question is, since we've been talking about terminology here, the term hippotherapy, it means the same as equine movement. It sounds a little like a separate therapy. Could you speak a little bit to the use of that term? And I know you were very clear that this is a treatment tool.
Absolutely. Thanks, Nina. So I would say the best thing to do is to lead with the therapy. You're either providing occupational therapy, speech therapy, or physiotherapy. That is how you market yourself. That is the terminology you use. Hippotherapy is simply one of the many tools you'll be utilizing throughout one session with your client. So for example, if I'm using a pool or a therapy ball or a trampoline, I don't market all of my advertising and myself as a trampoline therapist or a pool therapist, right? I'm still an occupational therapist. So always lead with your therapy. And that way it keeps the lines very clear. I'm either providing OT, PT, speech, or, in Kathy's realm, it'll be mental health professional designations, right? So lead with your therapy.
Great. Thank you so much. Sarah Michelle. My next question has to do with roles, and I'll ask each of you in turn about roles. So there were questions about the volunteers or assistants in these sessions. Katy, you had mentioned the term equine specialist. It caused a little confusion in the chat there. I wondered if you could, to start, Katy, clarify, what role does a volunteer have in a credentialed psychotherapy session? Does there always need to be volunteers around, or can a therapist provide therapy without a trained assistant there when horses are incorporated?
Yeah, that's a really good question. I think this is where this area is constantly evolving as we really define these roles. And I think, in the vignette I shared, that was a situation in which the therapist was not working with assistant and if we're, creating this hypothetical therapist, this person had the very important horse competencies and horse background expertise, as well as the counseling competencies, in order to be able to interpret what was going on for the horse, to monitor the horse and monitor their client. I mentioned group therapy, and in that case, when the number of clients and horses in the arena increases, there is a lot of multitasking going on for the therapist. They cannot attend to every single client and horse at exactly the same time. And so having trained assistants who have expert experience with horses is vital, and that they have additional training in human behavior and communication, have excellent interpersonal skills, and are working, with the therapist to provide a safe environment. And that person can alert the therapist to an equine issue going on. For instance, if this horse is showing some stress-related behaviors right now, how would we like to proceed? So that assistant can be vital, depending on how many clients are in the arena with the therapist.
Great, great. So in other words, mental health therapists who incorporate horses, they absolutely need to be knowledgeable about horses because that's part of competency. Credentialed healthcare providers can't just do things. They have to be knowledgeable about what they do, and of course be credentialed according to the rules and regulation of their country, their province, their state, where we are at. But additional assistance can be necessary if logistically complex in a mental health session.
Yes.
And great. And Sarah Michelle, I'll ask you the same about assistance in PT sessions, OT sessions, speech sessions that incorporate equine movement. Can you say a few more things about the nature of those assistants?
Absolutely. So in our sessions, our sidewalkers are trained rehab aides or rehab professionals that do have therapeutic knowledge to apply and assist the therapist during sessions. And also when we're not using the horse, because the horse is only one of the tools, they can also help us in the clinic when it comes to things like PNF stretching or other modalities that we use, other tools. For the horse handler, we do have rigorous training because not all horse professionals know how to long line. And so we do need qualified staff to be able to long line in sessions to maintain the safety for the team and the client alike. And this is where, some centers have paired with CANTRA or Canadian Therapeutic Riding Association, equine professionals that are trained in long lining to be the horse handler, so the horse professional for the session. That is definitely an option there. But definitely for the therapeutic staff, I hire rehab professionals.
Great. Yeah. So there's a sort of separation of roles there, that the person who provides therapy and is involved in those client interactions has training in human interactions. And of course, when utilizing equine movement, it implies that the patient is placed on the horse's back. So there is some additional horse handling that occurs there. That's great. And I can also add, of course, that psychotherapy can include times where a patient is on the horse's back as well. We don't use the term riding for any of these things in healthcare because riding is a recreational pursuit.
Lena, if I can add to another thing we've done in the past is we've used students in Masters of OT-PT and speech for sidewalkers because they are refining their skill set. So that's been another really nice asset too.
Great, thank you. And while I have you, Sarah Michelle, we had a question about research specific to equine movement. Can you point to resources? I did mention yesterday that each category of the symposium themes, so healthcare in these different areas, learning services, as well as the recreational, adaptive, or therapeutic riding instruction, each area has hundreds of published articles. But yes, specifically, Sarah Michelle, on the use of equine movement as a treatment tool in therapy, what resources could you point to?
Absolutely. So the leading organization, which is the American Hippotherapy Association, that provides all the training for OT, PT, and speech, on their website, which is AmericanHippotherapyAssociation.org. They have a beautiful research tab, and there's an updated bibliography there that you can access for research articles that have been validated and that are using proper terminology as well, because you'll see, as a lot of you have seen tonight, when terminology is interchanged or not used appropriately, some research studies that seem to be talking about the use of equine movement for therapy purposes and other things is actually talking about adaptive riding or vice versa. So you'll find a very clear list on the AHA's website that uses proper terminology as well.
Wonderful. Thank you for that. The next question is going to be for again, both of you. So we'll do it in turns here. We had several people mention in the sent-in questions about having a space, having a farm, having a facility that at this time doesn't have healthcare services. So there's no therapist on site who uses that location as a clinic location. What should a facility owner or manager consider? And, we have these, Sarah Michelle here represents not only OT, but also PT and speech pathology at the moment. And then Katy represents counseling and psychotherapy. So I'll ask in turn, what should a facility owner or manager consider or expect when a healthcare provider, a therapist is working at that facility? Katy, let's start with you.
Yeah, that's a really great question. And I see so many folks reaching out with this type of question these days of how can I partner, for instance, with a therapist to provide my facility. And I think for me, what really stands out as important issues to consider are very much logistical. Is the facility able to provide private space? So that is key, critical for privacy and confidentiality. And again, talking from the counseling psychotherapy side of things, that not only is there a space to work with the horses privately, but that there's also for instance, a more traditional office somewhere on the property in which the counselor and the client can meet, again, privately and confidentially. And so that for that to happen, the person who's interested in partnering with a therapist needs to consider, okay, what's going on at my facility currently? Can I actually carve out an entire day, for instance, in which, for instance, boarders do not come on the property? And we know that could be very complex, right? So you have to decide, do I have the private confidential spaces that will be necessary? And then to expect that a counselor or psychotherapist who might want to partner with you, or even considering leasing space to that person and potential use of your horses, this will all require lots of ongoing conversations and dialogue to assess the situation. And for instance, if the horses could be an appropriate fit and that sort of thing. So that's where I would start, is logistically, can I provide a confidential and private space for psychotherapy services?
Great, thank you. And yeah, same question to Sarah Michelle.
Yeah, so similarly, so when it comes to OT, PT, and speech, equine movement is not always appropriate, and you can't market yourself as only offering equine movement as your only tool. And so you need to have a clinical space. You need to have a clinical space with other tools available. That's number one. Number two is liability insurance, right? Are all of your therapists, do they all have individual professional liability? Do you have clinic liability coverage for therapeutic services? These are all things to consider, because it's not the same insurance as a facility that offers traditional riding lessons, right? We're not providing that same service. Ours is a medical model, theirs is not. And so there's different logistics involved there. Do you have all the tools, all the evaluations, all the materials that you're going to need to be able to provide this medical service? That would be the biggest one for sure.
Great. Yeah. So to summarize, for either therapy areas or the different professions, if you have then an equine environment of some sort where horses live and you're interested in having a therapist there to provide medical services, this is, like Sarah Michelle just emphasized, not the same as a horse business. So the therapist may come with their own clinic, their own business, and they're leasing office space. The office space just looks like some barn space and restrooms and perhaps access to horses who meet the criteria that is needed for that therapist, for the kind of healthcare service that they provide. And that's something that the therapist then will emphasize. But importantly so, it's not that they're coming in as another horse business. They come in as a medical business. They need medical office spaces. It's not just standing outdoors. And like both Katy and Sarah Michelle mentioned, equine interaction is just one of many techniques or tools that the therapist will utilize during their service. It's not all about the horse, in other words. My final question to each of you has to do with sort of competencies, ethical standards, that kind of thing. What should a therapist, or if you're a stakeholder, what should you be asking the therapists who say they provide equine interactions? We only have a few minutes left, so I'm going to ask each of you to keep your answers fairly short. But yes, what resources could you point to? And I was going to go to Sarah Michelle, but I will pause because I see she's hydrating. We're going to go to Katy. We're going to go to Katy first. Yes, what could you point to in terms of competency standards, that kind of thing?
So I can point to one document in particular that is published through the American Counseling Association. And Nina, is it all right if I pop it in the chat box, the link?
Sure, you absolutely can. Yes.
Right. So this is the animal-assisted therapy in counseling competencies through the American Counseling Association. This is one particular association that has written them out, published them based on research, past research. So don't quote me, I'm trying to remember the date, I think 2016. And so this is a starting point in terms of the competency areas for counselors in particular who incorporate not just horses, but any species in their practice. And so I would point to the ACA for a starting point there.
Great, thank you. Yes, those competencies came out in 2016.
Oh, I got it right. Oh, and it's in the link. That's one of those moments. Yeah, thank you.
Thank you. And yeah, same question to you, Sarah Michelle. Best practices, competencies, ethics, what can you point to when it comes to PTs, OTs, and SLPs who want to incorporate?
Well, first and foremost, Nina, the OT, PTs, and speech all have their regulatory college or regulatory body. And so they will dictate your scope of practice and best, your guidelines in terms of what your scope of practice is, what you're allowed or not allowed to do. So that is number one priority. Number two, the American Hippotherapy Association, if you're interested in using equine movement as a tool in your practice, they have a standard of best practice guidelines for all therapists that incorporate equine movement as a tool. They provide the education. And then there's a separate entity, the American Hippotherapy Credentialing Board, AHCB, that provides the credentialing exams, which we talked about that there was two different designation levels. And so really, if you're looking for a therapist to provide these services, I would say you're looking for a credentialed therapist so that you know that they have the skill set to be able to provide a safe and effective treatment tool for your client.
Wonderful. So yeah, the emphasis here is for all stakeholders who are looking for therapy for themselves, for somebody in their family, to look for people who are credentialed as the therapist they are, and look for people who know that they're providing, let's say, occupational therapy, that they're not saying they provide hippotherapy, because like Sarah Michelle said, that's just a treatment tool. Same on the mental health side. In order to incorporate horses in mental health, you have to be a credentialed mental health professional and work in a therapeutic orientation, more cognitive leaning, maybe trauma specific, and then incorporate, or positive psychology, as we saw the example there, and incorporate horses into that process. And with that, we are concluding our Q&A, and I want to acknowledge so many great questions. I think over 50 questions have come in, and I will now pass it on to Braylon. Thank you.
Thank you, Nina and Sarah, Michelle, and Katy. And thank you to all of you who joined us to embark on this learning experience about the role that horses can have in human health and learning. We hope that you will join us tomorrow for the symposium's final session. Tomorrow, you will see Lynn Thomas, CEO of Arenas for Change, discussing ways that interactions with horses can contribute to social and emotional learning and personal growth. The session also tackles the confusing topic of adaptive and therapeutic riding, where Haley Edwards, Cantra Senior Instructor, will explain what adaptive riding is and is not. Please take a few moments to fill out the survey via the link in the chat. Your feedback is important to us and will help us to plan future equine industry symposiums. If you'd like to learn more about the BBRM Equine Management Program, you can visit the University of Guelph website under Academic Programs and Bachelor of BioResource Management. The link will also be in the chat. To start tomorrow's session, we'll be announcing the winners of tonight's prizes. Make sure you join us to find out if it's you. Thank you again to our guests and speakers, and our partners and sponsors, Ontario Equestrian, Equine Guelph, our official media sponsor, KX 94.7, Schlie's Saddlery, and Golden Horseshoe PEMF Therapy. Again, please take 2 minutes to provide feedback via the link for the survey. And thank you again for attending. Have a great evening, and we hope to see you tomorrow.